All these students are kindly requested to keep their mics off and take care if they doesn't. Okay, take care of your mic, students.
Hello, good morning, Dr. Manu. डॉक्टर मनु अनम्यूट कर लीजिए. हाँ जी, डॉक्टर सुनील ज्वाइन हो गए हैं.
यस मैडम.
ओके 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 डॉक्टर साहब. डॉक्टर साहब
जी
करें जैसे अगर आप बोले तो स्टार्ट करें या अभी रुक लें.
यस प्लीज.
ठीक है डॉक्टर मनु स्टार्ट करते हैं.
A very good morning to one and all, respected delegates and dignitaries. In this series of webinars, Ayush Vibodhini, conducted by Shrimati Urmila Devi Ayurvedic College and Hospital, I, Dr. Manu Verma, Assistant Professor in the Department of Kayachikitsa, Shrimati Urmila Devi Ayurvedic College and Hospital, welcomes you all. Let me first welcome Honorable Chairman Sir, Engineer Amardeep Singh Walia ji, for giving us such a wonderful platform for conducting such webinars. I would like to welcome, students kindly take care of the mic. Let me continue. I would like to welcome our worthy principal, Dr. Meenakshi Nath, and Vice Principal Dr. Mridu Sharma, under whose guidance and encouragement such an event is turning to be a huge success. I would also extend a warm welcome to our spokesperson, Dr. Deepika Bhandari, teaching staff and non-teaching staff of Shrimati Urmila Devi Ayurvedic College for their constant hard work and sincerity. Now, moving further, in this series of webinars, Ayush Vibodhini, today's lecture is from Kayachikitsa. A very gracious welcome to our keynote speaker, Dr. Sunil Thakur. We are highly thankful to you for taking out your precious time and accepting our invitation. Thank you so much, sir. Now, I would request our principal, Dr. Meenakshi Nath ma'am, to kindly say few words of wisdom.
Thanks, Dr. Manu. A very special good morning to everyone and a wholehearted welcome to all the delegates who have joined in today's milestone session. Ayush Vibodhini Webinar Series 1 has reached its destination today, and I am very much glad to share this moment of joy with you all. Ayush Vibodhini webinar series is not a single-handed outcome, but it is the result of team effort. So I take the pride to thank our team leader, Dr. our team leader, Engineer Amarjeet Singh Jiwalia, for their belief and continuous support. Our Vice Principal, Dr. Midhu Sharma, as her energy and determination has made this happen. And also she is working day and night for the further upliftment of the Institute, and she is leaving no stone unturned. A well-deserved thanks to our Chief Coordinator, Dr. Deepika Bhandari, for her sincerest of efforts and dedication from day one of this idea till date, and also in upcoming series second and third. I'm also thankful to Dr. Deepika Minhas for successfully handling every meeting on TMAP. And I am also very much thankful to all subject coordinators because they were in continuous touch with chief coordinator and guest speakers for the smooth going of every day's session. My sincerest thanks and gratitude towards all our guest speakers, as their valuable and precious lectures were the sole reason that we waited and joined every session. And last but not the least, I am indebted to our keen delegates. Your overwhelming and continuous support made this series a successful event. And with this note of thanks, I again request you all delegates to remain connected with us in Ayush Vibodhini series second and third also. And for the milestone session of today, we have Dr. Sunil Thakur with us. Dr. Sunil Thakur is a scholar of his subject, and the topic which he is going to share with us is the vulnerable topic of modern world. It is diabetes. I'm very much sure that this topic will help us to enhance our knowledge and our approach towards the disease will change. I welcome you, Dr. Sunil, for your lecture, and I am very much thankful to you for accepting our request to be our guest speaker. एक बार फिर से बहुत बहुत शुक्रिया, Dr. Sunil. Over to you, Dr. Manu. Thank you so much.
Thank you so much for your kind words, ma'am. Now, before moving further, let me first introduce you to today's keynote speaker, Dr. Sunil Thakur, sir. Dr. Sunil Thakur, sir, has excelled both as an academician and as a physician. He has rendered a long period of service of 26 and a half years. He has served as HPAMO for 16 years and has a teaching experience of 10 and a half years. He has both served tribal and sub-cadre. He has been the in charge of District Ayurvedic Hospital Mandi for 2.5 years. He has given a total of 11 All India interviews, 4 at All India Radio Shimla and 7 at All India Radio Dharamshala. He has attended 10 CMEs conducted for Kayachikitsa teachers, has published 8 papers. He has received first prize at NIA Jaipur in paper presentation. Sir has guided 3 PG scholars, co-guided 15 students, while 6 students are doing PG under his guidance. 6 are still under court guidance presently. Now, the topic for today's webinar is Diabetes a Challenge. Diabetes is one of the most common diseases in today's world. So, before delaying further, I would like to request Dr. Sunil Thakur, sir, for enlightening us with his lecture. Over to you, sir. Thank you, sir.
Thank you, Dr. Manu. Good morning, everyone. First of all, I would like to thank all of you to join in the national webinar series Ayush Vibodhini in the Department of Kayachikitsa, organized by Srimati Urmila Devi Ayurvedic College of Medical Sciences and Hospital. And special thanks to Chairman Engineer Amarjeet Singh, Principal Dr. Meenakshi Nath, Vice Principal Dr. Mridu Sharma, Subject Coordinator Professor B.L. Mehra, my Guruji, and Dr. Manu Verma, my student, faculties, and organizers who have such a type of wonderful, knowledgeful webinar series in COVID-19 scenario and give me an opportunity to have a discussion on a burning point Topic: Diabetes, a challenge. Let us start, please.
Yes, sir, you may start.
Diabetes. Diabetes, a challenge. Diabetes, a challenge. Diabetes historical perspective. In Ayurveda, it is known as Madhumaya, but not described in independent disease in Britraj. It has been described in various sanhitas and textbooks of Ayurveda as the adverse stage of prameya, that is excess turbid urination. The term diabetes originated from Greek word for siphon, that is marked urination in patient, and mellitus means sweet, that is sugar in urine. History of understanding of diabetes. In 19th century, John Rollo coined the adjective mellitus. Claude Bernard of France described glycogen storage in liver in 19th century. Paul Langerhans of Germany described small clusters of cells in the pancreas. These cells were named islets of Langerhans by Lagrange of France. In 1989, Minkowski and Mering from Russia, and in 1992, Dr. D.R. Benting, Best, Collip, and MacLeod of Canada worked on dogs for the involvement of signs of diabetes and pancreas insulin effect in diabetes. D.R. Benting, Nobel Prize winner in 1923, treated first time the diabetes patient with insulin. In 1936, Sir Harold Percival Emersworth suggested that type 1 diabetes was different from type 2 for diabetes. Personal glucometer was invented in 1970. Until 1980, insulin was derived from animal pancreas. In last decade, new drugs, insulin and insulin delivery system has been made available. Since 2000, investigation role of stem cells in the treatment of diabetes is continuing. In 2016, Food and Drug Administration has approved artificial pancreas in USA. That is our today's topic, why diabetes is a challenge. As we all know that we are going toward the gold medalist of diabetes in coming years, because we have 70 million people in India which are confirmed diabetic. In 2030, it will come 100 million patients, and in last 2 decades, the prevalence of diabetes has increased by double, and it is expected to be increased by 170 to 200 in next 2 decades. In India, every fifth patient of diabetes is from India. Nearly 8% of population above 18 years had diabetes. 75% of type 2 diabetes patients have first degree of family history of diabetes. 80% of type 2 diabetes patients are either overweight or obese. Diabetes related complications are more common in Indian than other population. About 20 to 30% of diabetic patients develop vision or kidney related disease. 50% of diabetic patients develop nerve disorders, neuropathy like sensory loss, non-healing foot ulcer, and sexual loss. Silent heart attack and brain strokes are more common in diabetic patients. In every 10 seconds, one person dies from diabetes-related complications in India. Net loss in India's national income is from diabetes and cardiovascular disease have been more than $350 billion between 2005 to 2015.
सर
Why
स्लाइड्स नहीं
Indian
चल रही हैं.
1 minute.
Slides are not running, sir.
Yes, coming.
Yes, sir. Yes, sir. आप
Yes,
चल
sir.
रही हैं.
Now visible.
Yes,
Yes,
sir.
sir.
We are
Yes, sir. Yes,
visible.
sir.
Okay. 50% of diabetic patients develop nerve disorder, neuropathy like sensory loss, non-healing foot ulcer, sexual loss. Silent heart attack and brain strokes are more common in diabetic patients. In every 10 seconds, one person dies from diabetes-related complications in India. Net loss in India's national income is about from diabetes and cardiovascular disease have been more than $350 billion between 2005 to 2015. Why Indians are more prone to diabetes? Greater affinity to develop syndrome X. The syndrome X has increased abdominal girth, high blood pressure, high blood sugar, and deranged blood lipids. Has first step to diabetes. Indians have as much as 1.5 times more cholesterol fat in their body. A combination of genetic factors, excess of fat over body, abdomen, and liver has resistance to action of insulin. Non-alcoholic fatty liver and fatty pancreas may cause dysfunction of insulin-producing cells. Switching to a more modern lifestyle is aggravating the problem and driving Indian even closer to diabetes. A number of genes have been identified in Indians which could predispose them to diabetes as compared to other races. A gene, myostatin, which may cause excess fat and low muscle mass is common in Indian. There are other genes which may combine with each other or with bad diet or inactivity to produce diabetes. Characteristics of diabetes. Diabetes mellitus is a metabolic disorder. Insulin, a hormone secreted from pancreas, helps glucose to enter the blood cells and control its blood level. Blood sugar increases when the secretion or action of insulin decreases. Other organs like liver, kidney, muscle, and hormone dysfunction of which contribute to high sugar level. When sugar is unable to enter the cells due to inaction of insulin, the cells are deprived of energy which cause fatigue and weakness. A man is said to be pre-diabetic when blood sugar level are between normal and diabetes. A person with pre-diabetes is at 50% higher risk of cardiovascular disease. In pre-diabetic stage, correct diet, physical activity, lifestyle modification, and some drugs could revert to normal glucose status. Types of diabetes. Type 1 diabetes mellitus. Type 1 diabetes mellitus or juvenile diabetes or insulin-dependent diabetes. Type 1 diabetes is an autoimmune disorder due to non-production of insulin by destruction of beta cells, production in islets of Langerhans in pancreas. Type 1 diabetes occurs in approximately 5 to 10% of diabetic patients from childhood to young stage. It is the stage or it is one of the type of diabetes which occurs in early age. It occurs in young age and lifelong dependence on insulin, sudden ketoacidosis, and sometimes coma are common in type 1 diabetes. Type 2 diabetes mellitus. Type 2 diabetes mellitus or adult onset diabetes. Type 2 diabetes patient is able to produce insulin in his or her pancreas. Body tries to overproduce insulin to counter rise in glucose, but later on insulin secretion falls as pancreatic beta cells get exhausted. It is usually occurs among people of 30 years or more. Type 2 diabetes gradually onset over a period of time without symptom. It is strongly linked to overweight and obesity. Gestational diabetes. Gestational diabetes, pregnancy-related diabetes. Many physiological and hormonal changes during pregnancy produce stress and resistance to action of insulin is called gestational diabetes. Factors causing gestational diabetes include obesity, late pregnancy, family history, previously delivering a child weighing 4 kg or more. A woman with gestational diabetes may have hypertension, increased risk of miscarriage, cesarean section, section delivery, diabetes later in the life. Complications of gestational diabetes are large size baby jaundice, birth defects, lung problem, or low sugar level immediately after birth. The next is maturity onset diabetes of young. It occurs in young people of below 25 years. Its prevalence is about 1 to 2%. Strong family history and gene mutation, obesity, common factor for MODY. Latent autoimmune diabetes in adults. In some patients, slow destruction of beta cells occurs and there is slow progression of diabetes. Last for years is called latent autoimmune diabetes in adults. It manifests in adulthood and onset is insidious. Determinants of diabetes. Presence of one or many of following determinants make a person disposed to develop diabetes. Genetic predisposition, type 1 and some extent type 2 diabetes are driven by gene. Family history, 70% of type 2 in India have first degree family or relative with diabetes. And in obesity and overweight is found about 70 to 80% of type 2 diabetes patients, and lack of physical activity increases especially the abdominal fat, which is one of the causing factors for diabetes. Lack of vegetables and fruit intake, it leads to low intake of fibers, essential fatty acid, and antioxidant, which may cause sluggish glucose metabolism. Use of steroid and drugs can inhibit the action of insulin and increase sugar production in liver. Polycystic ovarian disease and gestational diabetes mellitus go to develop chance to develop diabetes in future. Low birth weight and childhood catch-up obesity may be affected by hypertension and diabetes later in life. In physical as well as mental and psychological stress, the body releases stress hormone which increase blood glucose level. Long-term exposure to stress, allostatic load increase the risk of high blood pressure, heart attack, and stroke, etc. Signs of diabetes: obesity, overweight, that is fat all over body, abdominal obesity, pendulous ovidum, double chin and heavy neck, hanging chin, bull neck, dark pigmentation and thick skin at nape of the neck, acanthosis nigricans, double layer of fat at back of neck like buffalo hump, multiple small skin tag over neck. One minute. Okay. Hello, Dr. Manu? Hello?
जी sir.
You can share this picture from your side?
Yeah sir, sure.
No.
Yes.
Yes, sir, we can see.
Yes. Start.
Pictures are not displaying, but
Yes,
the
sir.
written material is visible.
Yes, ma'am.
हाँ जी.
Please share.
Sir, picture is visible
Yes, sir.
now.
Yes, it is visible now. Okay, okay.
आपके visible है?
हाँ जी, हाँ जी.
sir, आप.
हाँ जी.
हाँ जी, sir.
ठीक है. Thank you, Dr. Deepika.
सर विजिबल है आप पिक्चर्स आपकी.
हमारे में नहीं विजिबल नहीं है.
सर आप कर सकते हैं, शुरू मैंने कर दिया है शेयर ना. आप स्लाइड नंबर 26 डिस्प्लेड है सर एट दिस मोमेंट ना. 26 नंबर स्लाइड चली हुई है. साइंस ऑफ डायबिटीज.
खैर इस पे नहीं आ रही है नहीं, अब इस पे भी नहीं आ रही है ना।
अच्छा जी।
मैं दूसरे लैपटॉप पे खोलता हूँ कंप्यूटर।
अच्छा कोई बात नहीं, कोई बात नहीं सर, कोई बात
2 मिनट।
कोई
There
बात नहीं
is
सर।
some technical issue. We'll join you just for in few seconds. Dr. Ajay, when sir is back, okay, there's some technical issue.
ओके डॉक्टर साहब, ओके डॉक्टर साहब।
यस डॉक्टर मनु।
हाँ जी सर, अभी
यस स्लाइड
material is
26 नंबर स्लाइड है।
okay sir.
तो साइन ऑफ डायबिटीज, sign of diabetes is number 1 thinning of hair, acne, red cheeks, moon face, buffalo humps, increased body and facial hair, weight gain, purple stare, pendulous abdomen, ecchymosis resulting from easy bruising, thin extremity and thin skin, subcutaneous tissue and slow wound healing. Next is buffalo hump. This is the picture of buffalo hump. अगर हमारे पास कोई पेशेंट इस तरह के आता है, क्योंकि साइन जो है वो डॉक्टर ने देखना है, तो डॉक्टर अगर साइन देखता है तो उस किसी टाइप का पेशेंट अगर किसी और प्रॉब्लम के लिए आपके पास आता है और आपको इस तरह के कोई साइन सिम्टम साइन दिखते हैं, तो आप उसको डायग्नोज कर सकते हैं कि ही मे बी या शी मे बी ए पेशेंट ऑफ डायबिटीज. These are the signs which a doctor observes. Next is acanthosis nigricans. This is one of the skin problem in on face. Next is diabetic blister, that is input. Next is thickened skin. Next is bacterial infection common in eyelids. eruptive xanthomatosis in limbs, fungal infection, common input, diabetic foot, double chin. These are the pictures. And now symptom of diabetes. Symptom of diabetes mellitus. These are the of symptom both type 1 and type 2. Symptom first we will discuss about symptom of type 1 diabetes mellitus. That number 1, frequent urination, polyuria, increased thirst, polydipsia, increased hunger, polyphagia, dry mouth, unexplained marked weight loss, blurred vision, abdominal pain and vomiting, dizziness, confusion, and loss of consciousness. Ketosis, a life-threatening situation. Symptom of type 2 diabetes mellitus. The following symptoms are characteristics of all types of type 2 diabetes mellitus. 50% of type 2 diabetes mellitus have no symptom, and many times diabetes is detected at a routine investigation. And next is tiredness and constant fatigue, slow healing of cuts and wounds, yeast infection of mouth and private parts, tingling and numbness or swelling over teeth. Diagnosis of diabetes. These are the cuts for plasma glucose, that is when sugar is less than 100 mg per day, that is normal. 100 to 125 is pre-diabetic. 126 and above is the indication for diagnosis. Random blood sugar test measured regardless of timing of meal, if more than 200 mg per day, indicates diabetes. Oral glucose tolerance test. It is the gold standard for diagnosis of diabetes. In this test, 75 grams of glucose is given orally with mixed water, and blood sugar level is measured after 2 hours. OGGT indicates that less than 140 mg per dl blood sugar level is normal. Between 140 to 199 is pre-diabetic, and above 200 is diabetic. Glycosylated hemoglobin or glycated hemoglobin test. It is the one of the important tests which is done for 3 month based test, and when it is less than 5.7 mean normal glycemic status, and when it is 5.7 to 6.4 mean pre-diabetic, and if it is above 6.5 or above, that it is diabetic patient. Common complication of diabetes. Generally, in uncontrolled blood sugar level, complications start early. Otherwise, with increasing duration of diabetes, complications start 10 to 15 years later since diagnosis. Overweight, obese, and inactive patients with uncontrolled blood sugar and diabetes of longer duration are more prone for developing complications. Those who have addiction of alcohol, smoking have more serious complications. Types of complication. The complications are divided into 2 groups. That is, one is acute complication, next is chronic complication. In acute complication, these complications start over a short period of time and which can seriously injure the body and may even cause death. There are 3 common causes of acute complication are hypoglycemia, hyperglycemia, extreme elevation of blood sugar, and increased acid in blood. Hypoglycemia occurs when the blood sugar falls below 50 mg per day, 70 mg per dl. Causes of hypoglycemia: delayed or too small or skipping of meal, excess dose of insulin or oral antidiabetic drug, more than usual exercise, excessive alcohol intake, onset of kidney disease, vomiting, diarrhea, poor oral intake, chronic disease like tuberculosis, cancer, liver disease, etc. Symptom of hypoglycemia: sweating, intense hunger, trembling of hand, dizziness and nausea, nervousness, difficulty in concentration, weakness, palpitation, headache, confusion, seizure, semi-consciousness or unconsciousness in severe hypoglycemia, nighttime hypoglycemia with sweats, headache, restlessness, and sleep are common. Treatment in hypoglycemia, immediate treatment. The patient must be act immediately if blood sugar level goes below 70 mg per dl. 2 to 3 teaspoonfuls of any simple sugar, honey, glucose should be given immediately. 1 to 2 cups of fruits, juice or Coca-Cola can be given immediately. 5 to 6 pieces of chocolate or mithai should be given immediately. In severe hypoglycemic emergency, patients should be hospitalized and intravenous glucose and glucagon injections should be administered. This is the one of the serious condition in hypoglycemia. So in hypoglycemia, we should be careful about the hypoglycemia. In long-term care of hypoglycemia, in recurrent hypoglycemia, oral medication and insulin dose should be adjusted. Hypoglycemia often occur late night near about 3 a.m. because in 3 a.m. the gap between dinner and breakfast is too much long, and if the blood sugar levels is less than 90 mg per dl, then need to moderate diet and drugs. CGMS patch on device are used to check the blood sugar level. Glucose, sugar sachet, biscuit, chocolate must be carried by the patient. Patient must carry identification card, emergency contact number, medication, insulin dose, and contact number of doctor. Hyperglycemia. Excess elevation of blood sugar level above 250 mg per dl and less exercise, infection, trauma, medication like steroid, faulty dose of drugs or insulin, and stress increases the blood sugar level. Symptom: increased urination, dehydration, difficulty in concentration, blurred vision, fatigue, or sudden weight loss. Immediate care: immediate modulation of drugs, insulin and sometimes insulin infusion must be given. Long-term care: adjust medication, insulin, and diet. Physical exercise must be consistent. Extreme elevation of blood sugar and increased acid in blood. Ketoacidosis is a medical emergency and life-threatening if not treated timely. It is usually occurs in type 1 diabetes, rarely in type 2 diabetes. Early hospitalization is needed in ketoacidosis. Causes of ketoacidosis are severe deficiency of insulin, severe starvation, high alcohol intake, and certain drugs are common causes. Symptoms: that is excess urination, marked thirst, dry mouth, nausea, vomiting, abdominal pain, deep and labored breathing, semi-consciousness and unconsciousness. That is ketoacidosis coma. Immediate care: if blood sugar level is more than 250 mg per dl and ketones are present in urine, the patient must be transferred to hospital immediately. Drink water and sugar-free drinks 300 to 500 ml per hour. If blood sugar level cannot be checked for any reason, any abdominal pain, vomiting, nausea or confusion, unconsciousness in patient type 1 diabetes indicates ketoacidosis and may be rushed to hospital soon. Long-term care: the patient must follow a regular and strict regime, avoid ketoacidosis. Long-term complications of diabetes are diabetic retinopathy, vascular complication, diabetic nerve damage, diabetic foot, diabetic kidney disease, infection, sexual dysfunction, and other complications of diabetes. Diabetic retinopathy is the one of the most common cause of vision loss and blindness in India, and eye disorder like cataract and glaucoma. It is caused by long-term uncontrolled blood sugar level, hypertension, and high cholesterol level. Symptoms of diabetic retinopathy are blurred vision, sudden loss of vision in one eye or both eyes, black opaque spot in vision, flashing light in the field of vision. Long-term care are annual fundus test, complication of heart and large vessel, heart, coronary artery disease, peripheral artery disease, cerebral vascular disorder, atherosclerosis are common complications of diabetic patient. Heart attack and strokes are two main complications. Heart attack is common in Indian patients, especially in younger age group. Heart attack among patients of diabetes may be silent. Causes along with high blood sugar levels, smoking or ingestion of tobacco, high cholesterol and high blood pressure also contribute to heart complication. Symptom: chest pain, heaviness in chest, upper body discomfort, shortness of breath, nausea, vomiting, dizziness, lightheadedness, palpitation, and ghabrat are the common in diabetic patient. Immediate care: loosen the patient clothing, tie belt and make him feel comfortable. Put aspirin or sorbitrate in the mouth of patient. Call for ambulance to transfer the patient. If breathing stops, CPR should be started. Long-term care, exercise, good control of blood sugar level and good blood pressure are advised to early complication. Aspirin and cholesterol lowering drugs, statins are mandatory for patients above 40 years of age. Smoking and tobacco ingestion must be stopped. Angiography and coronary artery bypass may be necessary. Stroke, it is commonly occur without warning symptom in marked elevation in blood pressure. Symptoms are weakness and numbness of face, arm and legs, slurred speech, deviation of mouth, confusion, semi-consciousness or unconsciousness, vertigo are common. Immediate care. Put the patient in comfortable condition. Check and correct blood sugar level and blood pressure of the patient. Hospitalize the patient as early as possible. Long-term care. Keep blood sugar and blood pressure, blood cholesterol and other lipids under control. Blood thinner, aspirin and statins should be taken for lifetime under the supervision of physician. Quit smoking and so avoid alcohol intake. Diabetic neuropathy, nerve damage, that is neuropathy. These are the nerve disorder caused by the diabetes. 50% of diabetic patients develop neuropathy. Neuropathy mostly lead to various symptoms in arm, leg, feet, and eye. Excess alcohol, smoking, long duration diabetes, advanced age, and contributing factor for diabetes mellitus. Symptom: burning and crawling sensation in the sole and feet, tingling or numbness of toes and feet, difficulty in wearing slippers, frequent cramps, and loss of hot and cold sensation, pain during walking, lying down, sleep disturbance at night, like swords being put in leg. Long-term care, avoid all causing factor of diabetes, proper hygiene of legs and feet with control of blood sugar level is needed. Diabetes food, corn, ulcer, wound in the feet of diabetic patient are remarkably difficult to treat and need combined management skill of food of diabetic specialist and food expert, podiatrist. Some symptom: pain in one or both feet and thigh, failure of wound healing even in small pink, blue, black discoloration of toe or feet. Prevention and long term: maintain good control over sugar, cholesterol, and blood pressure. Check regularly of cuts, bruises, and minor wounds of feet. Annual checkup of nerve vibration perception and foot circulation test, and hyperbaric oxygen therapy, stem cell therapy, and negative foot care tips. Do not walk barefoot. Wash feet daily with lukewarm, clean and dry feet after wash. Avoid feet injury and do not remove corn or ingrown nails. Avoid excessively hot or cold temperature on feet. Diabetic kidney nephropathy. It is long-term complication caused by damage to blood vessel and filtration system of kidney. Small amount of protein leakage, that is microalbuminuria, is the first sign of diabetic kidney disease. In advanced renal dysfunction, significant by increased major protein leakage and major derangement in kidney, that is increased serum creatinine and blood urea levels. Even small increase in serum creatinine indicate significant kidney damage. Urinary tract infection with excess urination, burning sensation, and while passing urine or low back pain is especially common in females. Causes of nephropathy, long duration of diabetes, hypertension, hyperuric acid are common. Some drugs like ibuprofen, analgesic, diclofenac, naproxen, gentamicin, amikacin cause kidney damage. Decrease in fluid in body due to diarrhea, vomiting, and bleeding, etc. A symptom in diabetic disease, that nephropathy, that is leakage of protein, swelling over feet, excessive urination during night, poor appetite, nausea, vomiting, weight loss, and weakness. Care in kidney, continuous supervision by kidney specialist is needed. With kidney dysfunction, certain drugs, that is metformin, must be stopped. Insulin is the best medication for diabetic kidney. In advanced kidney failure, dialysis or kidney transplantation may be needed. During fever, pain, paracetamol, tramadol are safe in kidney. Infection, that is causing high blood sugar level, greatly decrease the capacity to fight infection. Longer duration of healing of wound after surgery. Trauma lead to superimposed infection. Common infections seen in the diabetes are skin, that is large boils, abscesses in the nape of neck, yeast infection in genital areas, coat of skin, upper airways and lung infection, pneumonia, tuberculosis, fever, cancer are common. Urinary tract in urethra, kidney, and prostate in female. Gastrointestinal infection, diarrhea, and abdominal upset are common. Prevention, good control of sugar, hygiene, and body, especially foot care needed. Vaccination for microorganisms like pneumonia, influenza, hepatitis, and typhoid should be done. Fever, cough, boil, urinary burning sensation, discomfort must not be neglected. Avoid dehydration caused by gastrointestinal infection like diarrhea and vomiting must be corrected. Sexual dysfunction of diabetes. Both sexes can develop sexual dysfunction. Men may have difficulty in libido, erection, or ejaculation and impotence. Women are diabetic with may have problems like lack of interest in sex, diminished sexual response, and lubrication of vagina. And diabetes-related nerve and vascular disorder, hormonal or thyroid disorder, certain drug beta blocker, atenolol, metoprolol, psychological stress, anxiety, depression cause sexual dysfunction in diabetic patient. Prevention and management. Good control of sugar level will prevent nerve damage and vascular disorder. Hormonal abnormality must be corrected. Regular aerobic exercise, BP and sugar measurement may be done. Smoking, alcohol may be avoided. Other complications of diabetes are liver disease, mental health disorder, hearing loss, intestinal dysfunction, gums and dental disease, cancer are common in diabetic patients. Prevention of diabetes, regular exercise, sensible and calorie restricted diet, and maintenance of weight with normal body mass index. Diet exercise should be more intensive in those with family history of diabetes, history of polycystic disease or gestational diabetes and pre-diabetes. Management, the general principle and goals of control of blood sugar are treatment of diabetes differ from patient to patient. Management depends upon the diabetes, dietary habits, age, sex, capacity to do physical activity, and presence of complication. Education of patient, judicious care, proper treatment, and regular follow-up can be used to control the blood sugar level. Good sugar level control consistently over a period of time is required to prevent complications. Blood sugar targets for control vary from patient to patient, and these are stricter for young patient and very strict to pregnant women or diabetes with diabetes. Management type 1 diabetes. Type 1 diabetes patient needed lifelong treatment with insulin and regular monitoring, glucose monitoring. Nutritionist and psychologist support is consistently needed for the diet and mental health, respectively, of type 1 patient. Parents, family members, and caretaker of type 1 diabetic patients should be educated about the symptom administration of insulin to check the blood sugar level, meals, and complications. In school going children, the class teacher and the healthcare provider at school must be informed. Diet plan must be made with the help of the dietitian. Exercise, patient should be 45 to 60-minute regular exercise and yoga. Insulin storage, proper insulin storage very important for its required action. Insulin does not work to its level when stored for too long or exposed to extreme temperature. It is used in two forms: insulin analogs and human insulin. Insulin analogs are more advantageous as compared to human insulin, as they reduce the risk of hypoglycemia and associated with less weight gain. Classification of insulin on the basis of half-life and rapid action insulin, short-acting insulin, intermediate-acting insulin, long-acting insulin. These are types of insulin based on mode of action: basal insulin, prandial insulin, premixed insulin. These are the basal insulin effect that is reduced faster hyperglycemia. Fasting hyperglycemia has long duration of action, should be injected in morning or it has short duration of action, should be injected at meal time. Premix insulin, it reduces both fasting and postprandial hyperglycemia, has two biphasic duration of action, should be injected at meal time. It is combination of basal and prandial insulin in a fixed ratio. These are the various types of the insulin with their mode of action, peak time, duration, and role of insulin. Management of type 2 diabetes mellitus. Management of type 2 diabetes depend upon elevated blood sugar level, body mass index, associated disorder like hypertension, high cholesterol, kidney, and heart disease. If patient is overweight and elevated blood sugar level within borderline, he can be managed with appropriate diet or lifestyle modification without medication. Oral medication like metformin should be started preferably at the time of diagnosis. Overweight suffering from infection like tuberculosis sometimes requires insulin and different drug as initial therapy. Educating the patient and family member. Blood sugar management, correct diet, exercise, medication, dose, time, and when to do follow-ups, and don't manage emergency situations should be given to patient and her family member and caretaker. Diet in diabetes. For control of diabetes, one need not undergo extreme diet, carbohydrate diet, or blood group diet, which have little scientific rationale and may have organ system. To the best extent possible, patient previous diet should be suitably modified instead of introducing a new diet plan. Glycemic index. It is a measure of how much a carbohydrate will affect sugar level. Low 0 to 15, intermediate 56 to 69, high above 70. Glycemic load. Glycemic load is the term used to describe the overall effect of carbohydrate by its quality and quantity in a particular food. Low 6 to 10, intermediate 11 to 19, high 20 or more. Glycemic index of fruit. Low is strawberry, cherry, pear, peach, orange, apricot, apple, plum. And intermediate is muskmelon, mango, banana, kiwi, pineapple, papaya, grapes. High watermelon, guava. Glycemic load of fruits: low strawberry, cherry, pear, peach, orange, apricot, apple, plum, musk, melon, mango, kiwi, pineapple, papaya, guava, watermelon. Increase intermediate is grapes, angur, banana, and high in anjeer. Fruits preferred in diabetes have low glycemic index or glycemic load, help to control the body sugar level. Generally, fruits having low glycemic load are preferred in diabetes. Fruits advisable for diabetes patient about 100 to 50, 150 gram per day in divided dose. Strawberry, blueberry, Indian gooseberry, raspberry, mulberry, cranberry, and all. We can say that all berries and cherries are important for sugar patient, and they have no any side effects for increase the sugar level. Next, Dr. Manu.
हाँ जी सर.
स्लाइड
हाँ जी सर.
डिस्प्ले करना प्लीज. स्लाइड डिस्प्ले करना. स्लाइड की प्रॉब्लम आ रही है. अब पिक्चर ऑन स्लाइड.
ठीक है सर.
हाँ जी.
ओके सर.
Slide. These are the various herbal medicine which we can take in the patient of which we can give to the diabetic patient. These are the common medicinal plants, that is Grit Kumari, adrak for digestion of arm, methi, that is important for the reduce inflammatory inside the body, improve digestion, promote milk flow in breastfeeding, help with eating disorder, maintain healthy testosterone, improve cholesterol and high control of blood sugar levels, and improve exercise performance. Next is dalchini, next is dugdrom, karela, gudmar, health benefits of okra, that is bindi, and that is nilbadri, and these are the other food groups. The food groups are carbohydrates, complex carbohydrates, whole wheat, that is jaw, brown rice, oatmeal, refined carbohydrates, maida, semolina, white bread, white rice, soda, sugar drink, candies, and cookies. Complex carbohydrates with low glycemic load, with load value 55 or less, are common, slowly digested, absorbed, and metabolized, and cause a lower and slower rise in blood sugar level. Complex carbohydrates are preferred over refined carbohydrates. Next is protein. Animal protein, poultry, egg, fish, meat, milk, dahi, and paneer. Plant proteins are beans like soya beans, kidney beans, nuts, and dal, talc, etc. And plant proteins are preferred over animal protein. Fats, the saturated fat, ghee, butter, cream, coconut oil, and meat. Monosaturated fatty acids are olive oil, canola, mustard, nuts like almond. Saturated fats are fatty fish, flaxseed, mustard oil, canola, soya bean, etc. And N6 fatty acid, omega-6 fatty acid are sunflower, soya bean, oils, palm oils, nuts, and almond. Trans fats are vanaspati. Saturated fats should be used with precaution in diabetes patient. Fibers, soluble, oats, bran, flaxseed, barley, and isabgol are taken. Is insoluble, that is wheat bran and peach cherries are given. Vegetable, cabbage, and spinach. Other important dietary habits should be water intake Drink should be 1.5 to 2 liter, 8 to 10 glasses of water per day. Alcohol, regular excess intake of alcohol is harmful. The intake of alcohol should not be discouraged, and blood, fats, liver, and pancreas conditions should be kept in mind before drink. Acceptable drink intake of alcohol is 120 ml per week, that is 2 small drinks twice a week. Salt is sodium plays important role in nerve conduction and fluid balance, and in the body which depend upon kidney function. Salt intake should be less than 5 grams of sodium chloride per day. Balanced diet. A balanced diet contains group of food nutrition such as energy yielding fruit, carbohydrates, fats, body building, and protective food vitamin is incorrect preposition. Cooking oil should be not be more than 3 teaspoonfuls per day. The components of a balanced diet differ according to age, sex, physical activity, economic status, occupation, pregnancy, and lactation, etc. 1/4 of food that meal should be grain or sticky food that is rice, roti, broccoli, besan, corn, or peas. Another 1/4 should be protein, that dal, fish, poultry, or curd. Half of the plate should be filled with non-starchy vegetable like ladyfinger, cabbage, salad, etc. Glycosylated hemoglobin goal should be in diabetic patient. It is adverse or it is average of previous 3 months sugar control. That is, these are generally guidelines for glycosylated hemoglobin. Young person from 20 to 40 less than 6.5%. Middle age, that is 6.5 to 7%. Early that above 70 is 7 to 8%. Children less than 18 years should be less than 7.5. Artificial sweeteners are used in the diabetic patient. These are artificial sweetener, sugar substitute, non-nutritive sweeteners, and chemicals or food addictive. The artificial sweeteners available in India, approved by U.S. Food and Drug Administration, are sucralose or aspartame, available as powder or and pellet form. Saccharin, available in powder or pellet and liquid form. Acesulfame, potassium, available as powder. Neotame and Advantame are newly launched. Stevia, available as powder or liquid extraction. Side effect of sweeteners are laxative effect, bloating effect, diarrhea, weight, weight gain, and increase in bowel loss. Drugs for treatment in the diabetes are inpatient with mild elevation of blood sugar level. Diet control and exercise management help to control the blood sugar. Once started, drugs of diabetes must be taken regularly and direct by directed by physician. Some drugs used for diabetes are sulfonylurea, biguanide, alpha-glucosidase inhibitors, jolidinedione, glycinidase, DPP-4 inhibitor, GLP-1 analog, SGLT2 inhibitor. Other drugs which are used in the patient of diabetes: aspirin, statin, fenfibrate, amlodipine, beta blocker, angiotensin converting enzyme, angiotensin receptor blocker. Thank you.
Diabetes mellitus is itself a big disease which cannot be covered in a single lecture. But Dr. Sunil Thakur sir has beautifully tried to cover every aspect of it in today's session. Thank you so much, sir, for enlightening us with today's lecture. Hope today's lecture has removed several of your doubts regarding diabetes. Now, the house is open for questions and queries. Any questions from anyone? I think there is no question as such from anyone. So thank you everyone for joining us on this series of webinar Ayush Vibodhini. The next seminar is going to be conducted on 23rd of August. Thank you so much, sir. for wonderful lecture.
Thank you. Welcome.
Thank you so much,
Thank you.
sir. It was
Welcome.
a wonderful lecture.
Thank you. Thank you. Thank you,
Quite
doctor.
Thank you. Thank you so much.
Okay.
Thank you.
Namaskar.
Namaskar.
Namaskar, sir. You all may leave the meeting now. Thank you so much. We all will join on 23rd of August for the next webinar lecture. Thank you.
Thank you, Dr. Manu.
Thank you, ma'am.